Have you ever seen a loved one who was in pain and suffering while fighting cancer or some other type of pain? I have. I witnessed my mom go through the horrible after effects of chemotherapy and radiation from cancer treatment. Many of us have witnessed this awful suffering people go through who are battling some cancer or other affliction. Also, many can relate to the experience of helplessness you feel when there's nothing you can do to help and you see the nurses pushing morphine and other types of drugs that basically incapacitate the person. Can medical marijuana work better to alleviate the pain, nausea, depression, and overall comfort level of our loved one? I think it can. What is medical marijuana? One definition, according to drugabuse.gov, is the unprocessed marijuana plant or extracts to treat disease or symptom. So, how do you use marijuana? Marijuana can be smoked, it can be in a pill form, uh, in an oil, edibles, and vapors. The main chemical that helps people with nausea, appetite, pain, and many other ailments is called cannabis or a cannabinoid. Again, according to drugabuse.gov, the FDA has not approved marijuana for medical treatment, but has approved two forms of cannabinoid in pill form, dronabinol and nabilone. There are over 100 different kinds of cannabinoids in the marijuana plant. Some of these cannabinoids can also be created in a lab, which are more powerful and dangerous than those from the marijuana plant itself. Many people argue that marijuana should be used for medical treatment, and many states have already legalized marijuana for medical use. So, why hasn't marijuana been approved by the FDA to treat illnesses? The FDA performs thousands of tests and clinical trials to help determine if a medicine is actually safe to treat patients, and there's not been enough research done. There's also a chemical in the plant that is called cannabinol, which has also been proven to help children with epilepsy and seizures. Scientists are actually breeding marijuana plants particularly for this cannabinoid. Now, for those who would want to abuse this special plant, will be disappointed as it does not contain the mind altering traits that tetrahydrocannabinol or THC does. The scientists actually extract the oil from the plant to administer to patients. THC does have favorable characteristics that help treat people who may suffer loss of appetite, nausea, inflammation, and muscle control. From the website medicalmarijuana.procon.org, scientists continue to do animal studies as well and have found that some extracts may kill certain cancer cells and reduce the size of others. Some of the diseases that marijuana can help bring comfort in are autoimmune diseases. Those are diseases that weaken the immune system. HIV, AIDS, multiple sclerosis, which causes gradual loss of muscle control. Alzheimer's disease, which causes loss of brain function, affecting memory, thinking, and behavior. Inflammation, pain, seizures, substance abuse disorders, and mental disorders. One of the hot topics surrounding legalization of medical marijuana is that it is a gateway drug. I actually conducted two interviews with previous users from the 70s and 80s, and both had the same reply that this just wasn't true. Gerald Mayo stated that when he used marijuana back in the day, that he had no urge to try to find something to get him more high, and really didn't want anything to do with hard drugs. He actually used it to wind down at the end of a long day, and actually said he was more productive and focused, which is actually the opposite of what you read on some of the sites. Kathy McPherson stated the same thing. She used pot while with friends, and mainly just the weekends, as it was just what people did back then, like someone having a glass of wine while relaxing or hanging out with friends. She also stated that she didn't want anything to do with coke or acid, which was a harder drug that we used a lot back at that time as well. Reports also suggest that there is not enough evidence to prove that this is true, and a lot really depends on the person using it. marijuana is more readily available and cheaper for some just looking for a high. Now, what are the negative effects of marijuana? My first thought was the smoke that is inhaled cannot be good for the lungs. And according to the NIH.gov website, some state that living in a city with pollution is probably worse than what the amount inhaled for medical dosage would be, which is 3 to 4 puffs a day or half a joint, which is a marijuana cigarette. Personally, I think anything going in your lungs that has contaminants in it is not healthy. But what is the risk to reward benefit? Another negative is that tests have shown teenagers who used marijuana showed less memory retention even after stopping these effects were proven to be prolonged. However, in our case, we're not talking about full-blown legalization, but medical legalization. This should still be considered illegal if a person does not have a prescription. Another interview I conducted was with a friend of mine, Dr. Rick Bolin, who is an internal medicine doctor. I asked him in general his thoughts on medical marijuana, and he stated plainly, it works. He mentioned all the symptoms people get from chemo and other illnesses. And then he also mentioned the downfall is that some doctors can prescribe pretty freely and could potentially pose a problem. That was something I didn't even think about, as I was thinking more on the health side of things. Some other negative effects can be secondhand smoke, altered senses, problem-solving skills, memory and learning. Again, from the NIH.gov site, some people also inquire if medical marijuana or marijuana is addictive. One study I came across stated that 1 in 11 people could become addicted, but there was really no evidence of physical withdrawal. Also in my research, I thought about the notion of how many people have actually died from smoking marijuana or using marijuana. So I went to drugabuse.gov and found that from the years 1996 to 2006, there was a study conducted. 0 people had died from marijuana, but 10,008 had died from medications used to treat the same ailments that would be used with medical marijuana. I thought that was astonishing. I just don't understand the FDA testing on those drugs. I think it goes to show that it's more than just the FDA regulations, and it's more to do with the notion of legalizing weed, as people would say. So in conclusion, I believe the use of medical marijuana in the treatment of cancer, AIDS, MS, childhood epilepsy, pain, nausea, and appetite is far safer than any synthetic drugs that labs are manufacturing today. I believe the key is to regulate it and keep doing studies while also trying to find ways not to promote the recreational use, as it may have adverse effects, especially in teens. Thank you.